My name is Dr Alikhani. I am Dean and Professor at CTOR Academy, and I'd like to welcome you to another session of CTOR channel. Today, we continue the discussion on sequencing your mechanotherapy. If you remember from previous sessions, we divided the mechanotherapy sequence to 3 stages. The first stage that we talked about was free object design, where we would address the major targets and major movements by using a free object design. Type of movement in this design defines based on the relationship between force and center of resistance. And unfortunately, not all major movement can be addressed through this stage. However, whatever major movement or major target that can be addressed, such as dental arch, a transverse sagittal vertical problem, or segmental, that is mostly vertical problem, we try to address at this stage. Individual teeth sometimes can be addressed at this stage, but some are so difficult that we postpone to do at the semi-restricted design or second stage that we will discuss today. And the last stage is retention. If you are planning to read more about the semi-restricted design as a second stage, I refer you to the chapter 9 of Mechanotherapy, volume 2. Semi-restricted design requires certain appliances. The most common one are aligners and braces. Today we are not discussing about the aligners because their mechanics is very different, and we are focusing on braces. Braces depends on the side effects that you may encounter, may require segmental setup or full setup. If movement in 2 segments are required before you adding the 3rd segment to decrease the side effects, therefore segmental mechanics is necessary. For example, you have 2 procline centrals, you have blockout laterals. If you do full setup, you actually can jeopardize the predentium of the centrals. You can increase the possibility of root resorption, and in addition, it compromises the aesthetic of the patient. You can decrease the time that the patient has braces on the front teeth by having a segmental mechanics and does not expose these teeth to any unnecessary forces. To achieve this segmental mechanics, first, you address the minor movement in each segment, which means you applying flexible wires. At this stage, each tooth acts as an anchor unit and active unit simultaneously. After you achieve a proper alignment of the teeth, you start to engage heavier wire, more rigid material. Now you need in each segment define your anchor unit. For example, you decided that molars act as an anchor unit, and you want to increase that by connecting them with a wire, let's call it transpalatal arch. And now you are ready to retract canine in a space that you made in the segment, whether through, for example, expansion, or whether through extraction or IPR, interproximal reduction. And you planning to utilize that space to retract the canine and make a space for the laterals. Therefore, segmental mechanics is required for those conditions that, including all 3 segments, 2 posterior segments and anterior segments, can jeopardize the health of one of the segments. We cannot go full setup. For retraction of the canine, because it's a major horizontal movement, you need couple to force ratio. So the type of tooth movement in semi-restricted design is defined based on couple to force ratio. After you achieve the proper movement, now you can go to full setup and achieve the rest of the movement. Sometimes full setup does not jeopardize the health of the adjacent teeth or adjacent segment. In that case, it's recommended to save the time, go to the full setup, again follow the same sequencing, apply flexible wires, follow with more rigid wires, reach to the point that you can engage all the teeth in a nice rigid wire, then go to after the individual teeth with a major problem, whether it's blockout tooth that you need to make a space and then bring it in, or whether it's uprighting a molar. Uprighting molar usually requires significant amount of moments difficult to achieve during the first stage of the mechanotherapy. Therefore, we usually wait until all the teeth are aligned and they can function as an anchor unit for you, and then you apply one couple system or two couple system to start to upright the molar. So if you decided to start your patient with a semi-restricted design, and majority of the patients that they don't have complex problems like as dental arch problem or segmental problem actually can be start from the semi-restricted design. You need to just decide if the full setup can be traumatic for the patient and you need to start with segmental, then progress through the full setup, or you can just from the start go to the full setup. In both cases, do not engage the tooth with the major problem until you have the prerequisite movement, for example, making a space or having a proper anchorage. Too early does not solve the problem, it's just add to the side effects and prolongs the treatment. After you did with semi-restricted design, and now the dental arches are in each individual arch are properly assigned, you need to work on the coordination. At this stage, the inter-arch elastics play a significant role. Remember, intra-arch or inter-arch elastics can be used as an anchorage and can be used as a coordination of arches, and they play a role when you have a rigid wire, not when you have a flexible wire. So as you're progressing through the rigid wire and you are ready for application of horizontal forces, intra-arch and inter-arch elastics start to play a significant role. You're done with the semi-restricted design. The last stage is the retention that we will talk in another session. I hope you enjoyed this session of CTOR channel. If you have not subscribed to our channel, please go ahead and subscribe, and please don't forget to press the like button. Thank you.